Hi, my name's Haley.
And I'm Savannah, and today we're going to be talking about rheumatoid arthritis.
And how it affects the clinician and also the patient.
So Haley, what is rheumatoid arthritis?
That's a really good question, Savannah. Rheumatoid arthritis is best known as a chronic inflammatory disease affecting many joints, most commonly in the hands and feet.
Rheumatoid arthritis causes painful swelling, and after a long period of time, it can cause bone erosion and joint deformity.
Rheumatoid arthritis has common symptoms of pain in the muscles, back, and joints. Plus, it can also cause fatigue and anemia throughout the whole body.
Unfortunately, RA is not curable, but luckily it can be managed with medications like analgesics, NSAIDs, and corticosteroids.
So you're probably wondering how this affects dental hygiene.
And how this poses as a challenge to clinicians and patients.
Patients with rheumatoid arthritis often experience adverse effects pertaining to the oral cavity.
Did you know that patients with RA are more susceptible to periodontal disease, temporomandibular dysfunction, and salivary gland dysfunction?
People with rheumatoid arthritis are twice as likely to have periodontal disease. Since both RA and PD are chronic inflammatory diseases, they both result in the destruction of collagen-rich tissues. Because they both are characterized by inflammation, they work hand in hand together.
The temporomandibular joint is one of the most used synovial joints in the body. People with RA have a greater severity of temporomandibular dysfunction than normal patients. TMJ is prominent in approximately 50% of RA patients. This results in reduced mobility of the joint, like opening the mouth, pain while chewing, and a common clicking noise when the joint is in function.
Salivary gland dysfunction is also common in rheumatoid arthritis patients. Due to RA's inflammatory characteristics, salivary glands are susceptible to swelling. The inflammation causes reduced salivary flow, resulting in xerostomia. Buffering is then reduced, which may increase the presence of caries.
Wow, I guess all of these conditions pose as a challenge to both clinicians and patients.
Seriously, I had no idea. Let's hear it from a real rheumatoid arthritis patient and see how she handles going to the dental office.
Hi everyone, I'm Kelly, and I've been diagnosed with RA since 2016.
Thanks for being here.
Thanks for having me.
So what are some of your common symptoms with rheumatoid arthritis?
I mostly have pain in my jaw, neck, and knees on a daily basis.
Specifically, what areas bother you the most during your appointment?
Mostly just my jaw and neck. It's really hard for me to keep my mouth open for the duration of the appointment without experiencing pain and soreness during and after the appointment.
What's one thing you would want to tell all future clinicians about caring for a patient like you that today's clinicians seem to skip over?
I would tell them that knowing a patient's medical history is really important. We may be considered more difficult patients, but we have the right to be as comfortable as patients without special needs.
That is such great advice. Thank you for your time.
So what can we do as healthcare providers to better accommodate and help those patients that are suffering with rheumatoid arthritis?
Let's go find out.
Some things we can do as clinicians is first to check a patient's medical history beforehand so we can be prepared for the patient. We can also provide neck pillows or let the patient bring their own if that makes them feel more comfortable.
Clinicians should also inform patients that if need be, they are allowed to take breaks to prevent pain and stiffness during the appointment. Letting the patient close their mouth for a minute or two will decrease the likelihood of TMJ pain during and after the appointment. Let's check back with Haley and Dorsey.
Bye! Thanks for watching! Say bye, Dorsey! Yeah. Goodbye!